Okay, so it's a couple of minutes after 10 o'clock. So why don't we get started? Just wanted to welcome all of you. Joe Ichter, who is the Regional Community Health Investment Director in your area, is someone that we partner with, and he was planning to join us, but was unable to, but just wanted to let you know that thanks to Joe, a lot of you were invited to today's open house, and really very grateful for your time. And this is an opportunity for the St. Joseph Community Partnership Fund to introduce ourselves to you. We were hoping for an open house in person, but we're very grateful that we're able to do it virtually. And for today, we're going to introduce the fund. And let me introduce myself first. My name is Gabriela Robles, and I lead the fund, as we call it, and I'll introduce the team in a bit. And for today is introducing the fund to all of you, sharing with you some of the work that we've had in place as part of our grant making and investments, share with you our plan for expansion, and most importantly to us is having time to talk about how we will partner with all of you in Oregon in serving your communities. And before we get started, we would like to open up today's session with a reflection from Sister Suzanne Sasses, who founded the Community Partnership Fund almost 35 years ago. So thank you.
At the heart of Catholic healthcare is the healing ministry of Jesus, taking care of the neighbor without distinction, taking care of the poor. St. Joseph Health has been doing care for the poor and community benefits since its inception and before its inception. But we didn't do it because of government regulations. We're doing it because it's the heart, it's the purpose for which we're in healthcare. St. Joseph Foundation, as it was originally called when it was founded in 1986, was founded at the request of the sisters who had said to our first CEO, how are we going to continue taking care of the poor? We're in this ministry. It is a ministry as well as a business. And the purpose of the ministry is to continue the healing ministry of Jesus. And if you go to the scriptures, you see that Jesus took care of everyone. He took care of them body, mind, and spirit. And that has caused us to do the best we can and to evolve as we saw the needs evolving. When we formed our health system, our fear was that our new leaders, who we irreverently then called the suits, because they were mostly men, might not understand how important all that was for us. So we said to our first CEO, how will you assure us that we can continue to take care of the economically poor? The Community Partnership Fund has been a way of expressing, of continuing our legacy of caring. I see the Partnership Fund as being the vehicle that's going to take our legacy of caring for the dear neighbor into the future. I've especially been proud of the systemic change that we've been able to bring about by developing communities, by empowering community leaders. That has brought whole neighborhoods and whole areas to a different level of well-being so that we can keep people well and keep them out of the hospitals. Everything in healthcare is changing. And if we are to continue what we call Catholic healthcare, there has got to go through all that change, the constant of the mission. I hope we all at St. Joseph Health and now Providence St. Joseph carry on this legacy of caring, which is also the legacy of the Sisters of Providence, by continuing to find structures, policies, and programs that will give stability to this aspect of our mission that can move into the future. The hope I hold and the vision I hold is that in the midst of the constant changing and evolution of healthcare, we will remain faithful to caring for the dear neighbor who is close or who is stranger, body, mind, and spirit, continuing to extend the healing ministry of Jesus.
Thank you for that. And again, next year we'll be celebrating the 35th anniversary of the fund, as we call it. And the fund is to the Gates Foundation and the grant-making foundations that all of you have partnered with. And we are able, as part of coming together with Providence, now Providence St. Joseph Health, to partner with our community health investment teams internally, but also partner with other grant makers, and most importantly, with all of you. And so the fund was founded in 1986, and Sister Suzanne references serving the dear neighbor. And the work that we do is in alignment with the commitment to partner with organizations, with communities, to address the needs, but most importantly, to tap into the assets and strengths of our community to work together. And now that we're joined with Providence St. Joseph Health, we're moving forward and honoring the legacies of the Sisters of St. Joseph of Orange and the Sisters of Providence. It's a great opportunity for all of us. Next, please. And this is our mission statement, the St. Joseph Community Partnership Fund. And it's really to provide funding and assistance to improve the health and well-being of the economically poor, and at the same time, tapping into utilizing the strengths and diversity of our neighbors to build vibrant communities. Together we can do more. And our philosophy, our value is to always partner in everything that we do. Next, please. A little bit about the team. And this is myself, and Jason Laxamana, who you'll meet in a bit, is the Senior Program Officer. Alicia Barrios is our Grants Manager. And we also have on the team Teresa Beard and Carrie Schoenwald, who work very closely with the team in providing support in the work that we do. Next, please. And within Providence St. Joseph Health, we thought it was important for you to see where the fund sits. And it's within the Community Partnerships Division. And as you can see here, it's a division that really focuses on how to address the needs of the community outside of the hospital walls. So within the team, we've got government affairs, we've got community health investment, where Joe is part of that team. We've got education, philanthropy, global work, global and domestic engagement, and the fund. And so this is another opportunity for us to leverage both internally with our partners to work with all of you. Next, please. And a little bit about the expansion. Almost 5 years ago, we came together as Providence St. Joseph Health. At the time, pre-merger, the fund was serving California and Texas. And now we have the opportunity to go beyond those 2 states and now look at 7 states. So our footprint includes Alaska, Washington, Oregon, New Mexico, Texas, Montana, and California. So these are all the regions that we will be supporting. We've already done some support, and we'll learn a little bit about that, but really fully supporting in 2021. Next, please. And just wanted to highlight our partners, our hospital ministries in Oregon that we partner with through Community Health Investment and Population Health. And just wanted to provide a bit about that footprint in Oregon and our presence there. Next, please. And just wanted to highlight that we want all of you to see us as an additional partner, another way for us to support you through our grant making. We don't want you to think that we are substituting or working, coming in and trying to do the work of philanthropy or community health investment. It's an additional way that Providence St. Joseph Health is committed for the fund to come and provide the support. So really think of us as an additional grant making resource for your community. Next, please. And now we're going to have Jason introduce Jason to highlight what we do and to highlight in the community. Thank you.
Thank you, Gabby. And good morning, everyone. It's nice to be with you, albeit virtually. I think Gabby mentioned that we had initially planned to be there with you in person. And when we were planning these open houses, they were not virtual, they were real open houses, being together, having coffee, having cookies and breakfast croissants and such. And unfortunately, as with a lot of other things in our lives and workplaces, we've had to make some adjustments. So we're making the best of technology of today, and hopefully sometime in the near future, we're able to get up there and meet with you in person, be in the same place, share stories and share ideas. And so, again, thank you. We are the fund, as Gabby said. We are a grant-making foundation. I think if you are familiar with some of the entities that are aligned and associated with Providence St. Joseph Health, and certainly the hospitals, you may be familiar with some of the other foundations. We are not a fundraising foundation. We engage in grant-making and distributing resources to the community. And again, this is in addition to maybe the relationships that you have at the hospital or at the health system right now. We're not replacing them. If you're working with Joe, you're going to keep working with Joe. But I think it's in many ways, as Gabby said, we are an additional resource, engaging in similar but sometimes different strategies. On the slide here, you can see that what we're calling strategic grant making, that it's not just a cash donation into the community, but really working with you to enhance the impact, to meet the needs in the community, and supporting through partnership, not supporting through passive grant making, but working with you, meeting the community where you're at in terms of capacity, in terms of opportunities, in terms of needs. I wanted to reflect back on our mission that our focus is on improving the quality of life for the most vulnerable, for the most economically poor and marginalized in our community. And it's really reflected in our name, that it's community, that's partnerships, and those partnerships we like to think are authentic, that it's relationship driven, it's give and take, it's a conversation, and it's about the fund. And in that definition, certainly there are resources and grant monies that are available, but it's more than grant monies. It's resources, it's technical assistance, it's deploying certain synergistic opportunities together. So as we go along today's conversation, there may be some questions that come up, and please have those questions. Use the chat function. I guess one of the limitations of being in a virtual open house is we can't call on people right away. We will have some time later on in the open house to answer some questions. But for now, if something does come up, whether it's about something we say on the slide, maybe it's about some of the initiatives that we'll be talking about later on, maybe it's about the fund itself, maybe it's about Providence St. Joseph, please ask that in the chat, and we'll get there. That said, we did want to try to make this a bit more interactive. And so we have a few poll questions that we wanted to get to, and in order to get a sense of who's here today. We have about 40 or so folks on the call, which has been a great turnout. As Gabby said, we've been expanding the fund, and we've been doing these open houses all throughout the regions. We've done them in Washington State, in Montana, in Northern and Southern California. We'll also be doing this in Texas and Alaska. So we're happy to be with you today and know that your participation is part of this larger effort that we're doing across the Western United States. So these poll questions will help us understand who's on the call. And it's not just an academic exercise, but really this helps us understand how to respond to community needs, who's doing what, so that we don't replicate the wheel or we don't try to go into places that maybe already have had some investment or some activity. We want to work with those groups. We want to work with you. And so we have these questions. To help facilitate that and to facilitate this conversation a little bit later on, I want to introduce our colleague, Paul Bonfante, who is been leading some of the technical aspects and technical assistance aspects for the Community Partnership Fund, and he'll lead us through this poll.
Good morning, everyone. Happy to meet you virtually. So I have just launched the polling questions. They may appear automatically on your screen. You may have to go to your control bar in the bottom of the Zoom and click on the polling button to get it. If you are viewing this on a phone, you may not be able to do the poll. That's okay. There will be other opportunities in today's meeting for us to get to know you a little bit better. But you should now be able to see the polls. There are 4 questions. How familiar are you with St. Joseph Community Partnership Fund? What's the primary focus of your organization? What's the primary population? And what counties does your organization serve? So I see a few people are already answering that. Great. Just a couple notes. There is a limit of 10 choices in Zoom. So there's for a couple of these questions, we do have other. If you are selecting other and you're so inclined, you can say what that other is in the chat and we'll record that as well. Also in the counties, we did add Clark, Washington, because we know many of you who are operating in Portland may also be going into Vancouver and Clark County. So you can choose that option as well. So again, we're going to give it a few minutes. I see people are answering. We'll give it a few more minutes for all the answers to get in, and then I will share the poll results with everyone.
And there was a question about, I know there's some folks who are within the health system that are participating today. Go ahead and participate in the poll too. I think that's helpful for us. Again, we are in addition to the resources that have traditionally been offered, and want to get an understanding of where we can build together. As you answer those questions, I do want to reflect a little bit about our strategic grant making. We don't view ourselves as a traditional grant maker. We believe in order for us to address the needs in the community, it takes partnership and it takes authentic conversations and co-strategizing. And so what you're answering here is important for us, that it's important for us to get at least some first touches on who's doing what you're working on, where you're coming from, so that in follow-up, we'll be able to work together. This is just a first step. Obviously, for many people, I think it's maybe the first time you've been exposed to the St. Joseph Community Partnership Fund. We don't want this to be the last. We'll have follow-ups. We always have time to do one-on-ones. If you, after this call, want to schedule a call to share more about your work, to learn more about us, we're happy to do that. And again, I think we're here for the long haul. We're building off of almost 35 years of work in our history, and we hope to at least be in Oregon and the Pacific Northwest for at least that long as well. So.
And it looks like everybody has voted. So I'm going to now share the results. You should now be seeing those on your screen.
So great, thank you for all sharing. It's not surprising, I think, most folks, my quick math skills, 96, 97% of folks are not as familiar with the fund. And that's right, we're kind of like a new kid in Oregon, but we hope to be there again for the long haul. Primary focus of your organizations, there are a lot of different organizations, and this is what we're seeing throughout the regions where we have had these open houses, really running the spectrum of need, of service, of justice across the community. And you'll hear a little bit more later about how we work, that we recognize the intersectionality between a lot of these issues. And as we try to address root causes, having impacts across these multiple domains is a result. In terms of population demographics served, this is in line with what we're seeing, but this is also where we want to work. We want to work in all these communities of need. And this is actually fairly helpful for us. The counties in which you are coming from, where you do your work and where you do your service, this will really help us understanding how we can build off of what you're doing, and maybe identify some gaps of where we can be helpful as well. So if you weren't able to participate in the poll, I know that there's always some difficulties. Feel free to add information in the chat. And later on, in this Zoom, through the wonders of technology, we'll have some Zoom breakout rooms where you'll be in a room with one or two members of the Community Partnership Fund, and we'll have a bit more of a direct conversation and allow some of that conversation to take place as well. So thank you for participating in the poll. As we move along in the presentation, I want to share a little bit about our framework for impact. As you see here, these are our pillars. These guide our strategy and inform our formation of strategy. First is a focus on the upstream, and I think the term social determinants of health has been out there for quite a while, and for us, it's one where, yes, of course, we're going to work in this domain. Really, the conditions where people are born, grow, live, work, and age. I also like to add where they play and pray. These are our communities. There are factors that are upstream, and this is where we want to work with our strategies. We have a focus on equity, that it's not just about providing services, but addressing equity at the root. And I'll talk a little bit more about that on the next slide. That we're intentionally collaborative, that we do things not siloed, that we don't come in as a funder or investor and try to tell groups what to do. We want to learn. We have no illusions that we know any better than what you're already doing. So we want to learn from that. We want to know how we support. We want to co-develop strategies. And being responsive in terms of meeting the community where you're at. This is being responsive to community needs and opportunities that exist, and being innovative. So you see these keywords: upstream, collaborative, community, innovation. All of these lead to equity, and that is our strategy. That equity is the goal, but it's also a foundational driving value for our foundation. That our strategies focus on addressing, improving, redesigning community level systems toward equity and justice. The next slide, a little bit more about social determinants. As described in the poll, I think a lot of the groups here are working in this domain. That it's not just about end results, but it's about issues, top line issues like housing, like food security and nutrition, economic opportunity and development, immigration status and immigration rights, and climate. These are critical factors for us to address in addition to health outcomes. I think when you look at our previous initiatives, which again, I'll fully get to, they're all new initiatives for folks here on this call, I believe, but we've worked and supported different organizations, helping meet immediate needs, helping meet emergency needs. And in many cases and in many ways, we're still going to do that. But for us, it's a yes and strategy. Yes to meeting the immediate needs. We have a moral imperative to do that, and addressing root causes. That addressing root causes is a new area for a lot of foundations, but for us, it's something that we've been really engaged with going back 30 years, but especially in the last 10 years, working with community organizations, working with neighborhood groups, working with community collaborations and partnerships to go upstream, to work on community factors, in some cases that has a policy or educational aspect to them. The next slide, this is where we talk about equity. And it's been obviously top of mind for a lot of folks throughout our country, throughout the world over the last couple months. What equity means is a term that has been used much more frequently recently. You're familiar with health equity. That we believe that health inequities, health disparities are real, and all grant making must address equity. And so it's not just this health equity aspect, but it's also about racial equity and justice and supporting strategies that operationalize investments towards equity. Our strategies are an attempt to operationalize our equity lens, that we're working towards achieving equity, not just health equity. Yes, that's important, but it's not just the resulting that a result is not just that we have more services, but we're actually changing and addressing systems and then empowering communities along the way. The next slide, I'll turn back to Gabby to talk a bit more about our collaboration.
Thank you, Jason. Just to continue with the framework for impact, the value, the guiding principles that we have, and we always ask our grantees to commit to collaboration, and we know that's not easy. We know it takes a lot of work, and sometimes we find ourselves saying, I might as well get it done myself. But we recognize with collaboration, in putting that time into it, results in something bigger and better. And so what we support and encourage is collaboration in everything we do, and we take on that challenge too. So we just want to share with you some of our groups that we collaborate with very actively, and how we have been able to successfully leverage those relationships in bringing funders, bringing decision makers and others to the table to work in partnership with all of our nonprofit partners to address issues. So just want to share with you that to us, collaboration is not an activity. It's not something we check off a box. It's really something that is part of how we do our work and how we engage with everyone. Next slide, please. In addition to collaboration, something that is very fundamental to us is meeting the community where they're at. We don't want to be seen as a think tank or an academic group that has all these theories of change in our office and somehow we expect everyone to follow us. We really want the community to be part of the work that we do, and to really share with you that most of our initiatives have evolved because of the relationship that we have in the community. And it's really about listening to what are the needs. So we may have data, we all have lived experiences, but it's really the community members that know what those issues are and probably have the best solutions and how we should engage with them. And this is how we work in meeting the community, is welcoming that partnership, that relationship, and pivoting, really adjusting as we go and recognizing that nothing's set in stone and that we're all focused on that end goal in improving the communities that we serve in partnership with others. So this is very fundamental in how we do the work, is meeting the community where they're at. And next slide, please. And innovation. Innovation is very important to us, and we're very fortunate to have a board that is very supportive of us taking on some risks. And while we're not taking on risks without acknowledging what that means, we take what we call informed risks. And really, it is that work around innovation that has helped us develop initiatives that have been a little different in the beginning, but as we've engaged with communities, have really demonstrated that we need to take on risk in the community in order to reflect, to learn, to improve, and to recognize that we can't contain how we engage in the community. It's not something we have in a box. It's really working, evolving, revisiting. So just know that when you engage with us, we're very open to innovation and very much open to recognizing it's not always going to work the first time, but how do we learn from that and how do we move forward together? Okay, next slide, please. And now Jason's going to walk with you a little bit about our new focus areas and just kind of highlight what those focus areas are, and hopefully you can start thinking about where are there some synergies for us to work together. Jason.
Thank you, Gabby. And yeah, these are our focus areas. I think when you look at where we've been over the last 30 plus years, it's all been leading here. And first off, just looking at the capacity building, housing, education, disaster. Looking at these, you may be asking, but aren't you a health foundation? I don't see health here. I don't see it explicitly called out. And in our strategy, it doesn't need to be called out, because I think what we're trying to say here is that we recognize that health encompasses or is a part of all of these issues, that there is an intersectionality between these issues, that if you, for example, don't have stable housing, or you are housing insecure, your health status is going to suffer. You're going to be presenting with different health issues. That if you don't have access to quality education, then again, health status will be affected. Or going within some of the issues within within education, that we recognize in some places there's a school to prison pipeline, and that youth have been criminalized. Certainly that has impacts not just on physical health, but also emotional health and emotional health of communities. That, as we're seeing in the pandemic, early childhood education and early childhood development has been impacted in terms of caregivers, in terms of child care centers being shut down, and what's the impact there, and what role do we have to play to address some of those issues. And it comes with disaster. I think in many places, a disaster response, people think about the first couple months, 2 or 3 months, of how do we meet the needs, the immediate needs, but thinking long-term about how does a disaster impact a community down the line? How do the effects of disasters have impacts 2, 3, 5, a generation later, because of the opportunities, because or the lack of resources? What is that created? So within that, there is this interplay with health, and calling out that fourth focus area of capacity building. That's also within all of these, but it's capacity building as a prerequisite to do this work, as a capacity building for sustaining the work, for sustaining a long-term strategy, both near-term impacts, but with a long-term outcome. On the next slide are our grant initiatives that we traditionally have had, and some of these are evolving, so they may not, some of these may not be coming to some of our new regions in the form that they have been, but in some form they will be. Certainly the lessons, the approaches are coming in our initiatives that are coming in 2020 and 21. The Emergency Food and Shelter Initiative is may be seen as more of a traditional grant-making opportunity, where we've provided resources to providers and organizations, shelters, for example, food banks, food pantries, groups that provide care coordination and coordination around case management for supportive services. We recognize that there's immediate need. In many cases, we're partnering with our local hospitals and seeing what they are doing through community benefit work and community health investment and supporting that. We're also going and trying to understand what are some of the larger issues in terms of collaborations around emergency food, shelter, and coordination. Looking at these other initiatives, our Intersections Initiative, our Community Building Initiative, these are investments where we are building capacity at different levels. Capacity in neighborhoods through our Community Building Initiative, working on developing community leaders that are from community, that are knowledgeable about important community issues and raising them up to become more involved civically. And within our Intersections Initiative, it takes that community building approach a step further by supporting collaborations and partnerships who are active in places that want to go upstream, that perhaps want to work in policy and advocacy, but really looking at how that creates landscape changes, maybe around housing equity, or immigration rights, or civic engagement. Going a little bit more on this theme of capacity building, there's what we've had sustainability initiative, that's support for nonprofits, not just to say hire a development person or a grant writer, but to take a look at the strategies that nonprofits have been engaged in and what do they need to succeed? What do they need to sustain their work beyond the immediate needs of the day? So not working within or not jumping from crisis to crisis that many of our nonprofit partners are dealing with, but how do we look at longer term capacity and sustainability for the sector? On our next slide, you may have heard a little bit about our COVID-19 response. And this may be for a couple organizations on the Zoom today that maybe the first time you heard of the St. Joseph Community Partnership Fund. Back in March and April, we were involved in deploying funding to groups across all 7 of our states and offering support for meeting the immediate challenges, the immediate needs to prevent the spread of COVID-19. And we're able to support about 3 organizations or collaboratives per region. This is our step 1 COVID-19 response. What we've done now on the next slide is what we're talking about, a phase 2, but it's really a recognition that it's much more than meeting that immediate need. We recognize that the need will continue, and so we'll go there. Our hospital system, our health system, and individual hospitals will be engaged in that. But for us, our initiative is about supporting collaboratives that, yes, will have an impact on COVID-19 and working with communities, but realizing that and acknowledging that COVID-19 is not a 4 or 5 month time period. I think we're all looking at that maybe in February and March. If we just get through the next 4 or 5 months, we can go back to business as usual. We know that that's not the case. We know that the impacts of the coronavirus are here. It's something that we will be dealing with and working with over the next few years. Hopefully few and not 10 years, but we're certainly positioned and understanding that the human and economic impact will be with us and our communities for quite a while. So how do we work with our communities to meet that need? And it's through this collective capacity building that we want to work. So our initiative that we have active right now, and I believe there are some on this Zoom call that have submitted a letter of introduction about their work for that initiative. That's our second phase of work for community recovery and resilience. That it's more long-term focused. It will propel and support organizations and collaboratives to do work not just in the grant period, but beyond. And looking at our future initiatives, this is a bit of the strategy that we hope to employ, that it's more longer term focused, that it meets the immediate need, but also takes aim at the root causes and works in partnerships. We still will fund, in many cases, standalone groups, but we're really looking at collaborations. We're looking at innovative partnerships, and we'll continue to build off of that. So while I know some groups applied for this initiative, it's not the only initiative. There's many more to come in 2021, and we're happy to share that. On the next slide is, in addition to our grant making, our role as a foundation, as a funder. It's about deploying our reach and our access and our relationships to help elevate learning. And this may be around data, this may be around supporting studies and research, community-based research in the field around equity, around disaster response and recovery, or facilitating and supporting convenings to get community members and stakeholders and policymakers together in the same room to come to a solution for our community. This is upstream. This is upstream work. I think everyone here understands or knows the term evidence-based. But how do you build evidence? And that's part of our role. We want to elevate what we know is working in the community and share it across the field and share it across different regions so that it becomes recognized as evidence. And thus, for those funders who have that requisite need to only fund evidence-based, we're here to help elevate that so that it becomes recognized evidence across the sector. So I know there's some questions that have come in through the chat. We'll share a little bit of time now, but I do want to give some heads up that we are going to be breaking out into breakout groups, and we can get into this, and we'll share a bit more about the collaborations, and we want to learn more about what you're doing and who you are. But I do want to answer some of these. There's some, what is your view on economic development? Yes, it's a critical part. And in our partnerships that we have supported, we've had economic development corporations and organizations a part of the strategic framework that we recognize economic opportunity is intertwined with education, is intertwined with health access, and it's something that we do consider and work with. Can you share an example of a risky or innovative project that you've supported? Again, I think this kind of goes back to this idea that a lot of funders, a lot of grant-making foundations only want to support things that are rooted in evidence, that you can find a published paper on, and here's the methodology. And we realize that for a lot of things that happen in the community and that community groups are engaged in, you do it because you figure it out with whatever limited resources you have, with the relationships you have in play, and we go in and we support that. So a risky investment may be something akin to what we do in our community building initiative, where we support and fund a group of residents, community residents in a neighborhood, to design a needs assessment, an asset mapping for their community. And through that process, identify 2 or 3 community issues that are important to them based on their methodology. And then we provide resources and we provide technical assistance to help uplift and articulate what those strategies could be to address those needs. And over a 2 to 3 year term through our community building initiative, allow those residents to implement what they deem as an appropriate strategy. We've been doing that for close to 20 years with our community building initiative. And out of that has come a lot of community innovations that are recognized as effective strategies. But before that, they were just ideas on a piece of paper that a group of residents wanted to put into play. There may not be a formal clinical metric that they started with. It became looking at what are appropriate community-based metrics and articulating that those have linkages to medical or clinical outcomes, but at the start may not be as aware. So in a way, it's kind of this idea that Wyatt Health Foundation is engaged in housing and in education, in community empowerment and community leadership. That's part of it. There's some questions on root causes of hunger, like community food projects. We're happy to have that discussion and what that means. I think we recognize that root causes also means issues of equity. You know, what are the policies and cultures and histories that have, in many cases, marginalized groups? Why are people living in poverty? Why do people have less access to housing or food? And addressing or building strategies that try to address that while also meeting immediate needs. So looking at the time, I know there's a few more questions and perhaps we can get to them in our breakout sessions. And of course, we're available after the call too.
Yeah, definitely. Thank you, Jason. Before we get to the breakout sessions, and just know that we will be addressing the questions either during the session or we are open to having conversations one-on-one or with your collaboratives. Please let us know. But I want to introduce Joe Ichter. He is joining us now, and he is the Director of Community Health Investment for Oregon. Joe, if you'd like to say a couple of words before we get ready for breakout.
Hi, thanks, Gabby. Thanks for the introduction. I'm sorry I'm a little bit late this morning. I'm excited about the partnerships that we're going to have with CPF. Obviously, it's a new opportunity for Oregonians to participate in this sort of funding mechanism. So some of the major differences between us are that, you know, as Providence and Community Health Investment, we follow investments that circulate with our community health needs assessment, and that's primarily our areas. And the Community Partnership Fund has a lot more leeway in how they structure where they're giving and what they're giving to. So I think it's rather complementary. And I've worked with Gabby now for about the last 6 or 12 months, and I'm excited to work with her and Jason and her team and to involve our community partners as we're doing today. Thanks, Gabby.
Great. Thank you so much, Joe. And so now we'll get ready for breakout. I believe Paul will provide some direction for this next session. Thank you.
Hello again, everyone. So as Jason and Gabby mentioned, we are now going to have some breakout sessions. So for those of you who have not done Zoom breakout sessions, they're pretty neat. What we're going to do in a minute or two is you are automatically going to get moved into a breakout session. You don't have to have a different link or anything. It'll just happen. You'll get moved into one of 3 breakout sessions. Each session will have its own facilitator and note taker who will ask you 3 questions, 2 of which are on the screen. The first question is not on the screen, and that's one we're going to ask you to put in the chat, which is just introduce yourself. So your name, the organization, your role at that organization, and what your organization focuses on. But then the next 2 questions we are going to ask you to speak verbally towards. The first one here is, what collaboratives are you involved in or do you know about in your area? And we're asking this both so the fund can get a sense of the collaboratives in your area, but also so you can hear it. So you may hear about a collaborative that you haven't heard of yet from one of your peers in your city, in your county, in the next county over. So we'll spend some time on that. And then the last one we'll do, where we'll spend the majority of the time in the breakout groups, is we're going to ask you to dream big. And so you may be familiar with the concept of a BHAG, a big, hairy, audacious goal. That's what we're really looking for. So if you had a magic wand, what major change would you make in our communities to have the most impact? And the facilitators will reiterate this, but this is really intended to be a brainstorming session. We're not necessarily asking to unpack the idea or think about the obstacles that are in the way of the idea, but really just to capture what your big, hairy, audacious goal is. So those are the three questions we're going to be handling. And again, your facilitator will orient you. So again, in about a minute, I'm going to move you into your rooms automatically. If you got here a little late, you may be in the main room for a second. That's fine. I'll get you in a breakout right away. And then you'll be in that breakout group until 11:15. At about 11:14, you'll get a text 1-minute warning. And then at 11:15, we will close the rooms. So you'll get an invitation asking you to move back to the main room. And if you don't move back to the main room, you'll get moved back automatically in 30 seconds. And then we will come back and your facilitators will do a brief report out. So that's what we're doing for the next 20 minutes or so. So now we're going to open the rooms and enjoy the breakouts. All right, I think we have everybody back. So thank you for taking the time in the breakout groups. We're now going to do a brief report outs from each of the facilitators, and we'll go in the order of the room numbers, which means Haley, Marilyn, Carrie.
Hi, everyone. Thank you to my breakout group for your very, active involvement and for sharing so much. Our group discussed a number of big, hairy, audacious goals, including housing for all. That was a very important one that came up over and over again. The importance of having housing in particular for those with mental illness who are over-policed, and there are aid and assist issues that shouldn't necessarily end the way that they do, and that came up a lot. And then not only mental health issues, but housing for seniors that become very vulnerable and do not have the income or program compliance that they need to retain housing. The importance of providing housing for those people. And additionally, housing just came up over and over again as a social determinant of health, as something that is important for all communities. Also, the issue that COVID has laid bare health inequities. A goal would be to address those inequities, which is a huge general goal, but it's very important. And to work on things such as providing sick leave, health insurance, healthcare for all, addressing the inequities, the fact that Latinx have been affected more by COVID than other groups came up. Additionally, the need for behavioral health compensation. So kind of policy issues, getting the Medi-Cal, Medicare, or not Medi-Cal, because that would be California, but the system in Oregon to cover behavioral health and reimburse behavioral health services for those who require them. Also a very interesting topic, the goal of, focusing on outcomes instead of only outputs as a system, as a community, evaluating to see kind of what our bigger impact in different areas were. That was shared. And in general, just addressing the need the need for housing, healthcare again came up, and providing information and adequate education so that everyone is able to access the resources they need. Food, housing, mental health support, etc. So information for that. That's it. Thank you.
All right, in group number 2, we had some similar thoughts that were shared from Haley. So there was a lot of conversation around education, so providing early learning for all children, no matter their race, skin color, language, economic situation. Also talking along those same lines about providing foundation for students from low-income families, specifically in elementary school, and connecting them with youth mentors. And we also talked about education funding, maybe changing that, and so it wouldn't be just through property taxes, but to find a way to more equally distribute the resources. And then we also had someone chime in about providing vouchers, so for housing for anyone who needs them, and just there not really being any qualifications for that, just, you know, if they need it, they get it. And then talked about how minority populations are more disproportionately affected by COVID right now, and to kind of come to them with testing instead of having them come to a clinic. And then, let's see, the West African community being recognized, and just hearing their voices and their needs. And then lastly, just to talk about different Oregon legislature. So that is representative and is accountable to the communities that they serve. And yeah, so that was basically what our group shared. There was a great conversation, and we talked about some other funding resources as well. So we had a great conversation. So thank you to group 2.
Hi, group 3 also had a really rich conversation. People were very brave and everyone spoke. And we had big dreams in group 3, starting with more housing and funding to build housing or repurposing existing housing in a variety of forms. And just to not shy away from the big issues, ending racism, homelessness, sexism, hunger, and poverty. And also more specifically to really move forward on a particular project around building a really nice trauma-informed clinic on a college campus that would actually have universal health care and not be reliant on volunteers to provide that free health care to those that need it most. Free dental care, family wage jobs, livable wages, and the social justice that would allow all of that to happen, that would allow for people to get the education they need and life balance and housing, and it would allow the opportunity to eradicate poverty and provide equal opportunities to people. And specifically for survivors of domestic violence, not just housing, but supportive housing, really needing life skills and wraparound services to enable survivors to not just have a safe place to be, but to actually move forward and thrive and not wind up returning to their abusers. And then at a more systems level, equitable representation in where decision makers are making their decisions at the systems level, really dealing with systemic racism against BIPOC populations so that all of it could change. And that was our group. We dreamt big.
Thank you everyone for your active participation. Thank you to our facilitators for running that and also reporting out. So we heard a lot of great big ideas, some commonality and some unique ideas. And the fund is going to be thinking about all of that. So I'm going to hand it over back to Jason and Gabby to take us home.
Yeah, well, first of all, I just want to thank all of you for participating, and very impressive the work that you're currently engaged in and your commitment in addressing some very complex issues. And so hopefully we will begin to figure out how we're going to work together on this journey. Just want to share with you a bit about what are the next, and so the next 6 months, so basically from now until probably early next year, we are looking to select initiative recipients for support. And so this is the Community Recovery and Resilience Initiative. And so before the end of the year, we will identify and our board will approve those recipients for that work. We will continue to strive to learn about your community. So this is just the first attempt. Please know that we will be reaching out to all of you to continue learning from each other and learning about your communities. And hopefully one day we'll be able to actually be in your community, working with Joe and really meeting with all of you in person. And then we'll begin implementing our strategies that we shared with you today, working to operationalize some of that work. And that it will include prioritizing where do we start and ultimately supporting all of you. And so for the next slide, please contact us. Don't hesitate. We've got an email address here on the slide, and we've got a website. So please, if any questions come up or if there's any ideas, we welcome you to reach out to us so that we can continue this conversation that we started today. Jason, anything before we end today?
I think you covered it, and I think, I see some questions coming in right now. Yeah, the slide deck will be provided. We'll be able to share that out. There'll be a follow-up email. There's also a recording, not of the breakout sessions, but of the general session that we'll be able to post on our website. So there's information here about our website. Please visit that. And yeah, if you like, we are available for follow-up conversations. You got a little bit of a taste of kind of our strategy, our orientation. We're happy to learn more about you and where we can partner. And I will say that we do have one initiative that is being vetted right now, but in my breakout group, I shared that there's more initiatives to come. Mm-hmm. And all the information that you provided in the breakouts and the chat, we'll utilize that. We hear you, and I think we hear you loud and clear about the need to go deeper on a lot of these issues, and that's where we want to be as a fund and as a partner. So I'm echoing Gabby. We're really happy to spend a little bit of time together. Hopefully we can be with you, not just virtually, but in person soon, and working side by side.
Thank you, everyone. Hope you have a good rest of the day. Thank you.